There's a new presidential administration, but the issue of taking care of American veterans remains a challenge. We're joined live by Michael Moreland of VA Healthcare to talk about what services are available and what people need to know. Good morning, Michael.
Good morning, Evan.
Well, you know, we're going to have, and we certainly do have already, thousands of Americans returning home. Their families are affected by their service, potentially their injuries and their health. What are maybe some of the biggest misconceptions families have, or what do you want families to know this morning?
Well, what I'm really wanting to make sure that veterans and their families know is that the VA is here for you, the Department of Veterans Affairs. We have hospitals all over the region that I cover, which is Pennsylvania, Delaware, and parts of New York, Ohio, and West Virginia. And there are other VA hospitals all over the country. And we really want veterans to know that they have an opportunity to come in. We're here for you to help you with your medical, mental health, and other social and financial issues. We want you to come so we can help you, and it's especially for those returning Iraq and Afghanistan veterans.
It's more than just injury, though. You talk about the psychological aspect. I imagine that's a large part of it, and again, those services are available to families and veterans, right?
Well, the services are available to the veteran.
Okay.
We work with families in association with the veteran, but the health care and the mental health services are really for the veteran. You know, the thing I'm trying to make sure people understand is that the VA is there. If you are coming back from Iraq, Afghanistan, you have a limited time. It's a 5-year window post-discharge. And so if you were discharged in 2004, your window is starting to close. So make sure that you connect with the VA and get in for services.
Now, one of the things we've seen, Michael, in the last 5 to 7 years is that suicide numbers have alarmingly gone up, and we've seen some suicide rates that are a bit alarming to families and people connected to the service. Is there anything the VA is doing or can do to address that?
Yes, you know, depression and suicide is a problem for a lot of people, but if you've been in a traumatic situation like war and conflict, it's even more at risk for you. And so what we've done in our region, for example, is we've hired over 350 new additional social workers, psychologists, psychiatrists. We're running different kind of programs and therapies to intervene. And so I'd like families and the veterans to know that if you have depression, if you have suicide ideas, you know, the VA is there for you. Call us, talk to us. Go on the web and find a VA hospital near you and connect with us. We're out there looking for you.
We also hear about homelessness being an issue with some veterans, perhaps older veterans as well. What have you guys done in that regard when it comes to veterans and homelessness?
Yeah, homelessness is a significant issue for, especially for veterans, and we've done a lot of things over the years, including having social workers out, finding homeless veterans, offering them assistance. A new program that I'm really excited about is a partnership we have with the Housing and Urban Development arm of the government. And what we're actually able to do there is get vouchers to pay people's rent, to get them into a house. To solve homelessness, you need to do 3 things. You need to find the person health care, you need to help them get a job, and you need to find a place for them to live. And that sounds simple, but it's not that easy to do. And so we've really approached all 3 of those issues with job training programs, with health care and mental health services, and now with this housing voucher program that we have. So if you're a homeless veteran, you know, you're not going to be sitting watching TV maybe, but somebody who knows you, somebody who can reach out and touch you, and we're sending social workers out. It's soup kitchens and all over the place to try to find homeless vets that we can help. And
lastly, before I let you go, I got to ask you about the state of affairs with finances and with hospitals across the country. As you're probably well aware, the Canandaigua VA Hospital is one in our area that a lot of people care very much about. There was concern over the past 5 years or so that perhaps it could close. How would you assess the state of funding, finances, and being able to keep facilities serving and open?
Yeah, Canandaigua is outside my region, so I really can't comment about that, but I can speak about finances for my region, and it's pretty consistent across the VA. In health care, you know, money is always a challenge because there's always something more you need to do, but we're funded fine. We have the resources we need. Like I mentioned earlier, you know, my employee base has gone up by several hundred since last year, and so we do have the resources we need to reach out to the veterans. And that's a year-by-year situation, but this year we're in pretty good shape. And that's the reason I'm here asking veterans, you know, if you're a returning Iraq, Afghanistan veteran, please, please contact us. Come and see us. We're here for you.
Michael Moreland, thank you so much for your time. Very important issue that affects so many families in every community in this country. We appreciate your time this morning.
Thank you very much.